one, is that correct? And medical social work can be involved in that?
Absolutely. We're able to go in with folks and work with them, work with their families, and help them to prepare and potentially having some of these tough conversations. Probably the biggest difference between palliative and hospice is palliative doesn't provide a bereavement service afterwards, after someone has passed. So, but prior to that, we definitely have a team approach with all of us on board if needed and people are wanting that.
That's the beauty of home health care in general. I mean, all of our programs do have a team approach. Mm-hmm. You do bring the family into a lot of the care that's provided, but with these two programs, the family's more deeply involved. Is that correct?
Yes.
In that you're doing more education and training with them on what comfort measures are and what they can expect through palliative care or hospice care. Who pays for those programs? Where does funding come from? Palliative care and for hospice care?
Medicare and Medicaid and some private insurances will pay for those as well. Okay. And we'll also work with people, as we always do, to provide care.
Okay. With hospice care, who is it for? What types of people receive hospice care? What kind of conditions? Is it only cancer? Is it only older people?
That's a misconception. Hospice is for anyone with a prognosis of 6 months or less to live. So it focuses on care and not cure.
Okay.
So hospice affirms life, first and foremost. We want to make the best of whatever time you have remaining and help you to enjoy the quality of your life with the best care that we can give you.
Mm-hmm. So that focus from a cure to caring, there alone brings up a lot of emotional aspects for families, and that's where you do some of that emotional and family support.
We definitely provide family support and for the patient as well. Provide emotional support during the process and following the death. Excuse me.
So there's nursing involved. Mm-hmm. What other disciplines? Nursing there to give the comfort measures, pain medications, and other comfort measures, nursing assistants.
Yes, LNAs would do the bathing and the dressing. We have homemakers that go in and help to tidy up the home. We have volunteers, which can offer companionship and respite, and a little bit of light housekeeping and maybe do errands. We have a chaplain who will provide spiritual support for people or help them to get connected or reconnected maybe with a religious group that they may have been involved in. Social work, therapy if needed as well.
Good. That's a lot of care and a lot of people going in. Is it 24-hour care? Explain the level of support.
No, it is not 24-hour care, but we are available 24 hours a day, 7 days a week. So for any concern that a patient or the family member may have, a nurse can make a call in the middle of the night if they need to do that.
Good. Is hospice always provided at home?
No, it is not, and that's another misconception that people have. Primarily, the majority of our patients we do see in the home, but we can visit people in residential. We take care of people in residential and facilities. Some people end up going to the respite house too in Williston. We don't have one here in Franklin County. But
when you mentioned the respite house, and just want to make note to people that all throughout Vermont, this is available through each county's home health care agency has a hospice program that they can access and link into. Sure. With hospice, you mentioned volunteer support. You being the hospice volunteer coordinator, can you tell us a little bit more about how our volunteers come to us, how they're trained, and what they do?
Sure. In order to become a volunteer, you have to have a lot of compassion and caring and good judgment. And we offer a 10-week program that we have a once-a-week training. And by the time you get finished, you're well prepared to go into homes to provide the respite and the companionship and all of that. We offer that generally twice a year. We're getting ready to have one. We still have some openings available, so that'll be starting on March 13th, and it'll run for 10 consecutive weeks. So they're trained in They have a class on advanced directives. We have a spiritual panel, communication, hospice philosophy, some body mechanics, stress management. They get to meet the interdisciplinary team. They also get to talk to present volunteers to find out what it's like to be a volunteer. And we offer ongoing education and support to keep them feeling comfortable in their role.
Mm-hmm. And you need volunteers in all parts of the county, and they have to be,
Yes.
What's their availability like? When do you call upon volunteers?
They just need to be very caring and need to be able to have transportation, reliable transportation, because we do have 15 towns in our county, and we do want to be able to provide services.
And as far as schedules, is it mostly daytime work or volunteer positions?
All
or?
times. We do get occasional requests for overnights to go and sit with the person so that the family member can get some sleep. So any time is a good time.
Talk about the communication with the team members and the volunteers involved, and just how that works, and doctors, family, staff. It's nice to have the big support of a team, but how does that work? How do you communicate and stay involved in what's happening in that home?
Well, we, I think our agency does that quite well, and we fortunately we do have a broad number of services that can be provided and try to touch base regularly. We do have bi-weekly meetings with our hospice staff and being able to check in if there are questions, concerns, things that need to be addressed, that sort of thing. And on a day-to-day basis, we're checking in with people through voicemail, person to person. If there are, again, questions or concerns, if I'm in there and client or family is mentioning an issue to me, we would either call home health while I was there or go back to nursing therapy, whoever it may be that needs to address the issue, if it can wait. So I think our staff is very good at connecting with people and bringing in the other disciplines as needed.
And I think one of the unique things at Franklin County Home Health is that our staff are home care and hospice staff. So you don't work just in home care or just in hospice. Everybody pretty much has had some experience in both, or has had experience in hospice care. So that's because it's such specialized care. It's nice to have that.
And it's also a real nice transition for patients if they're starting off with our agency in the home care setting, to then transition into, for instance, hospice services and keep that same staff that they've had all along and have gotten comfortable with. So,
talk about bereavement support for the family, and you talked about emotional support for the patient as they're facing this time in their life, but also talk about bereavement support and when that happens and what that entails.
Well, it's a wonderful part of the whole hospice program. We offer the bereavement support for up to 13 months after the patient dies to support their family and friends. And we have a grief support group that meets twice a month at the agency. It's no cost. It's held for, I think it's about an hour and a half every other week.
And that's open to anybody in our community,
Yes,
whether you've
it is.
had our services or not. They can come for a grief support group, sure.
Yep, and we also have a community remembrance service that's open to everyone in Franklin County that's had experienced the death of a loved one or friend, and that's been held annually in November, usually here in St. Albans itself. But it's really a wonderful way to honor and remember those that have passed away.
When you say you reach out to the family in intervals after a death, what is involved in that conversation or care?
We usually, as one of our social workers and nursing, we usually follow up with folks. Each family, each individual is different, but to help determine what they might be needing, what supports are really going to be most helpful, and then it's making telephone calls or doing home visits, sitting down with folks, talking about how the change has affected them, the loss of someone, giving them some ideas on how to manage stress and manage their grief and loss and identify that, helping to connect them with supports and resources if they're wanting and needing that. So it's really an individual basis in what people are wanting.
Wonderful. That's such special care, and we thank you both for all the care that you and your teams do at Franklin County Home Health, and for sharing today some more information about how to start this conversation, what's involved, what options people have, and we hope that people will visit our website at Franklin County Home Health Agency at www.fchha.org, and there's a link to the Start the Conversation website and other information about hospice and palliative care. So we do encourage you to talk with your healthcare provider or to call our agency if you have questions about this topic, and we thank you for your support. Our Franklin County Home Health Agency is proud to care for our community, and we do thank you for your support and for tuning in to join us today. We hope that you will join us again next month, and until then, be well, and remember to start that conversation with your family. It really is a gift. Thank you.